Thank you, Mr. Chairman. Thank you, Ranking Member. This is indicative of a much bigger problem facing healthcare. You're one small part of it, which looms huge because everyone sooner or later ends up with a prescription, even a vaccination now and then. The issue that most of us are confronted with, if you don't own a healthcare business, is that, listen carefully to Senator Sanders' opening remarks. You can probably take those as being representative of anyone that wrestles with the healthcare system that does not own a business in the system. It's gotten to be such a huge part of our GDP, unlike anywhere else in the world. You get into something extra normal like we've just gone through, it raises all kinds of issues. And I've been the senator most outspoken on, I think you run like an unregulated utility across the board. You don't embrace competition. You don't embrace transparency. And you're a small part of it. Hospitals now have gotten up to where they're close to 35 to 40% of the healthcare dollar, and that is even harder to find out how much things cost, how it's working. If you're in the business of free enterprise, which I think many on our side make excuses for it, that means no barriers to entry. That means full transparency, full competition, and don't try to business with the federal government and then want more from it when you're not performing well in the first place. Let's look at a narrow issue here. You're claiming that you need more because of the cost of distribution. Well, in any other field, I did it for 37 years, it's very simple. You have a network of distributors, dealers, you don't have PBMs in there that make it confusing. You need an MBA to look at that flow chart. When are you going to start making it easy for all of us to see what things cost and then not look to government when they were part of this formulation in terms of how we got the vaccination and then want more from it? You're involved in a taxpayer, involved in a lawsuit where you've got two smaller companies, Arbutus and Genevant, that are making a claim that you had a patent infringement. I'm hearing that not only here, but patent tweaking, patent infringements when it comes to where we spend even more money on biologics and biosimilars. Point being, whether it's a government paying for it or the private sector, it's a broken system, and you need to get better at it, or you're going to get solutions in the long run that you don't like. Your distribution system. Why is it something that you sound like you got to recreate it? Where's it been up to this point? How do you distribute your flu vaccines? Why do you need this much money? A 400% price increase is preposterous, especially when you've been given all this government largesse, and it's even going to protect you from these lawsuits. What's the nature of your current distribution system to where you can't just put this into it? And why is this that much different from what you've done for years in distributing a flu vaccine? Because it looks like we're headed more to where this is going to be like the flu than it's going to be something extra normal.
Thank you, Senator, for your question. So just to clarify, we do not have a flu vaccine on the market yet. We have one in clinical study. We should have a phase 3 data soon, and hopefully...
You may not have one on the market, but there's a distribution network for them from your competitors. Why wouldn't you be able to get into that? Why do you have to justify creating a new distribution network? No one would ever do that.
So indeed, Senator, we're going to use, but we have to set up a distribution network. I'm not saying that we're going to build our own warehouses like other companies do. We're going to work with companies, but we have to set up those contracts. During the pandemic, we only shipped trucks to 3 warehouses in the US when the CDC was taking the responsibility and the cost of getting the vaccine to hospitals, pharmacies.
So is government requiring you to do something different here that would cause you to use a different network? What do McKesson and Cardinal and the others do? There's a network to get this stuff to pharmacies already in the places they need to go. Why can't you blend it into that, keep the costs down, be a little entrepreneurial in what you're doing?
It's part of a solution we're going to be doing, Senator, is we're going to use existing networks, but we have to set up everything. Because we never had a commercial product before. We just have to go, which we are doing right now, through all the contracting, negotiating of all those rights and so on, to set up the distribution capability so that we can get the vaccine to pharmacies.
We're about out of time. You cannot as well as the rest of the industry, including hospitals, have the best of both worlds, where you want government to be in there helping you when it's tough, and to where, for the private side, most of us are not happy with the fact that we're lucky if your health insurance plan only goes up 5 to 10%, which incorporates hospitals, pharma, and maybe the Darth Vader of it all, the insurance business. Something's got to give, or you're going to get more government involved in healthcare. Thank you.